Good morning, everyone. Hope everybody is enjoying this snowy, wintry day here in Kentucky. My name is Troy Hearn. I'm the Active Living Program Administrator with the State Physical Activity and Nutrition Program, SPAN for short. And away we go. I'm going to let everybody know a little bit about the Active Living Program here in Kentucky, how the state of our condition for active living is today, and how we can do to make things better in our state. Currently in America, we have an issue, inactivity. The reason most Americans are inactive due to a lot of built environment issues. A lot of surveys have been done in the last 10 to 15 years, and most Americans say that they just don't have access to safe and accommodating physical activity. On average in America, 1 in 4 Americans does not receive the recommended daily physical activity. In Kentucky, that's more like 1 in 3 of Kentuckians do not get the minimum amount of physical activity on a daily basis. When asked, most Americans say they just don't have a safe, accommodating space or place to walk or ride their bicycles. Children nowadays, only 40% of children get their minimum amount of daily physical activity. You can see on the slide here, we know that walking and bicycling have some very basic, but very profound physical and mental benefits. We know this, and it's fun. Some of the overall health benefits from cycling, from walking, just being physically active. Not only does it make us feel better physically, but mentally as well, especially on these winter days and during this year, the season of COVID. A lot of people are kind of shut in. We're not as active. We're not going to the office as much. We're at home more. So our ability to get out is hindered somewhat. There's a lot of reports and study that show that proof is inactivity. Less cars on our city streets makes it more accommodating and safer, more appealing for people to get out and walk. More active people on our streets, by our businesses and our downtown areas means more money, more activity. Less cars, slower speed, safer for walking and bicycling. More people out on the streets. It's been shown that it makes the streets actually safer. People that are out of the cars, that are walking, that are bicycling, self-police the areas that they use the most for active living. If they see something funny, they simply just pull out their phones, take a picture of it, and report it. More money on the streets, better community. Okay, so in Kentucky currently, Kentuckians spend almost $28 billion on healthcare annually. Imagine if we could reduce that cost by 10%, by 5%, with just small things like Kentuckians being more active, bicycling or walking. If we could reduce that healthcare cost as little as 5%, we would have hundreds of millions of dollars extra to go into our economy to reinvigorate our local economies. More physically active Kentuckians, more physically active Americans actually improve our military readiness. Sad to say, over the last 20 years, our U.S. military has lowered our fitness standards 3 different times because of the average American's health is more poor than it was 20 years ago. So you may ask yourself, if you lived in an area with a lot of sidewalks or bicycle infrastructure, why do we need local planning? Why do we need to plan for things like walking and bicycling? That's pretty simple, right? Well, if you look at the one picture on the left there, this is an average urban area in America today. Sadly, the mode share for people walking and bicycling in Kentucky is less than 1%. So our transportation design, dollars, construction, and maintenance is mostly geared towards automotive travel. And oftentimes that can mean that accommodation for bicycling and walking is just left out. It's just simply not accommodating or safe, let alone if you're an American that has a disability, especially days like today, snow and ice are on the sidewalks and the bike walk infrastructure. Oftentimes those are the last things to get cleaned up, if cleaned at all. Like I discussed earlier, most of our mode share in the United States are people driving by themselves, one driver, one car, taking up space on the roadways. Our hope is that someday we get away from the less than 1% mode share in Kentucky for active living, and we start to increase that number a little bit more. It's been proven culturally, if a community starts to see more people biking and walking, if accommodations and facilities start to be designed better, constructed better, maintained better, that it has a growing effect. The more people you see, the safer you think it is, the more likely you are to try to maybe walk to work or ride your bike to work or for short trips. But currently, here's the status of our transportation network and our mobility numbers. Our goal in the SPAN program is to help change things by being proactive with Kentuckians' health. My goal in the active living program is to work with communities, small and large, and let them know the emphasis of local planning, local champions. That is the true power to change things. We provide resources and funding to empower the local community and the citizen. The local citizens and the community has the greatest power to change things for walking and bicycling in our communities in the state. And then there's a lot of communities that have bike walk master plans. In 2012, there were only 4 communities in our state that had a standalone bike walk master plan. Today, there's almost 60. So the best ways to learn how to do things is often following examples from other places. Here's some of the situations that we see today. I look at this with a different eye and view than probably most. Some would say that some of these facilities are accommodating, but are they truly? If an elder person, a person with a mobility device, or a person in a wheelchair can't use that facility, then it's probably not accommodating or inviting for people that are mobile as well. Our sidewalk infrastructure in our state is well over 50 years old, and in most cases, it is in dire need of redesigning, reconstructing, or changing things as simple as adding more curb ramps. So with everything, we start with the plan: people, locations, assessment, and networks. With the people, I think this is the most important in the start of the plan. People is everyone in the communities, professional community members, organizers. Everyone in the community has power to change things. Some of the resources that we provide with communities to help develop walk-back master plans or just to work on individual projects is starting with, where do people walk and bike now? Local resources use Strava heat maps. It is a free mobile application. It helps you track your individual biking and walking stats, but you can also use the Strava heat map to see where activity in your community is today. You can compare that with activities from a year ago and 5 years ago. Strava does have free information that they provide to communities, networks, and organizations like ours. We also integrate communities and citizens with the state highway plans. Knowing what you want, where you want it, and how it connects people to the places is exactly how the highway department determines what roadways need to be worked on, also with conditions of the roadway and so on. So we try to integrate bike ped planning at a community level with state level activities. And we also work with federal highways. Our federal highways and our Kentucky Transportation Cabinet have a dedicated bike walk program, and we work and partner a lot with them. Other organizations throughout the state that we work a lot with and partner with are area development district offices, organizations like the State Bike Walk Association, the Mountain Bike Association, the Kentucky Recreational Trails Program, universities, and so on. Many, many partners and organizations to make this come to fruition. Some of the communities that we have worked with, we've provided a sample survey to kind of feel the needs of where and what in the community. It's just a very simple survey. A lot of communities we work with have customized their own survey. We've also provided a template for a starter bike walk master plan. Once again, most of the communities that we've worked with in the past few years have taken this template and they customize it for each of their individual cities. If you look at the almost 60 individual bike walk master plans throughout the state, you can see that all 60 of those are different because no two communities are alike. This is some of the other data that we use. Partnering with the Kentucky Transportation Cabinet, we've done a statewide bike walk facility inventory. Knowing what you have now and what condition that is often one of the first parts of starting your plan. Once you see a network of where the sidewalks are, you can see the yellow lines on the photo below. You can see breaks in the sidewalk network. Oftentimes this will lead you to know where the most need for things like sidewalks are. Like I told you, we do partner with the Kentucky Transportation Cabinet. They do have a dedicated website for bike walk planning. A lot of resources there. And yes, I used to work with the Transportation Cabinet. I was the pedestrian and bicycle program coordinator with them. So we're proud that that partnership continues on today. And we hope to have that get even better in the future. These are some of the communities around the state that have standalone bike walk master plans. I do recommend a standalone plan as opposed to integrating bike walk need and wording into your community's comprehensive plans. Oftentimes comprehensive plans are only updated every 5 to 10 years or so, but oftentimes I've seen the need for the bike walk master plan to be updated as often as every 2 or 3 years. This is probably the fastest growing, fastest changing part of our transportation network in our state and our country is the non-motorized accommodation. At some point in our planning and design, you have to get things paid for. I'm a huge fan of having communities develop ways to pay for as much as they can locally, because local planning, local funding is the fastest way to get things done. But some projects are just simply too high of a price tag for that to happen. So that's where we work with federal highways and our state transportation cabinet for communities to seek state and federal funding. There is a match for that. So if it's a $100,000 project, you're going to be applying for $80,000 and you're going to be matching that 20%, that $20,000. So there always is a component for matching for that. To let you know, things like federal funding are extremely competitive. So a community really needs to have a certain amount of planning done to be competitive for this process. And we help a lot of communities with this. We also work with the funding programs with the Transportation Cabinet and federal highways. Okay, so it's a never-ending project or never-ending process. So most communities we work with today, we're in the planning phase. We would be moving into the design phase, then hopefully constructing some of these facilities in the next couple of years, but it never stops. These facilities need maintained. Just as an example for today, some of these facilities need to be cleared of ice and snow. A lot of communities don't have budgets for that. Well, clearing of ice and snow on bike walk facilities might need to be put into the budget, but there's always more work to do, and it's always a cyclical thing. So these are actual pictures of places in Kentucky over the last 5 to 10 years, and hopefully a lot of communities in our state have a good problem in the next couple of years. The facilities that they have now are going to see more and more use. The bike paths might need to be extended or made wider. Sidewalks may need to be added or made wider, and off-road facilities may need bigger parking lots because there's more and more people, certainly In the last year in the pandemic, we've noticed more and more people out walking and bicycling than ever before. And that is a brief highlight of the active living program within SPAN. Once again, my name is Troy Hearn. If you have any questions related to bicycling and walking, how your community could be more involved, how your community could be made better for bicycling and walking, please reach out to me. My email is on there, and we've left some time for questions, and I will send it back over to Ellen for questions in the chat box.
Thank you. That was great, Troy. I really appreciate your expertise and sharing all of your experience with bike walk plans, transportation, and public health. So we have a couple of questions. The first, and this is something that I've experienced in my own community as well, says the argument has been made by homeowners along proposed bike paths that they're concerned about increased crime coming to their neighborhood. Is this a valid concern? So I think that's a question about if you have a bike path that goes through your neighborhood or a walking path, it's going to bring in people who might be up to no good or something. What are your thoughts on that as a active transportation professional?
Overall, reports and research have shown that to be the opposite. Once a quality facility, let's just say a 10-foot wide shared use path, let's say that's constructed and that's put right behind the row of houses in your neighborhood. The people that use those facilities are just like you and I. It's active individuals. Let's say somebody's going for a bike ride there. The average cost for a bicycle or road bike now is around $1,100. Most of the people that are going to be riding an $1,100 bicycle are not criminals. Most of the people that are going to bicycle and walk on a quality facility next to your neighborhood are going to be carrying some kind of a smartphone. If they use that facility multiple days a week, there's a little bit of ownership that happens with a facility like that, whether that be a paved trail or an off-road trail. When you use something often, you just take personal ownership of it. You notice things like trash. You notice things like somebody that might be, look suspicious or something like that. You kind of call those things out. Also, just the increased activity for people biking and walking tends to lower the amount of people that might be up to no good. Now, the few caveats to that are if a facility doesn't have lighting, so at night, there may be an opportunity, for people that, shouldn't be there, might be out there at night. But if a facility is used, all hours of the day, then that's why I use the term quality infrastructure. There may be a need for lighting. Also with bike walk infrastructure near your house, near your neighborhood, or connections to park, it makes your property more valuable. It doesn't immediately raise the tax value of your property, but as properties are sold, resold over time, those properties are sold for a higher premium, and they're sold faster than facilities that just don't have those facilities there. So overall, the research and the reports have shown that having quality bike walk infrastructure near your home, near where you work, actually makes it safer, and it makes your property more valuable.
Great, thank you so much, Troy. We have a couple of great comments and questions in the chat box. One person said that they second what you just said about safety, so that really resonated. We actually have a question or a request here from our CDC friend, Sarah, who said, can you please share how long the process takes to bring the partners together, make a plan, and start to work on those projects? That'll be important context for people who are listening and thinking about this.
Well, we currently have 16 communities that are in the early stages of developing a standalone brand new bike walk master plan. We've been working with those communities for approximately a year and a half. We hope to have all 16 of those communities have a final draft this calendar year. So from start to finish, on average, for a community of say 25,000 people or less, it takes about a year and a half to get a quality bike walk master plan created, vetted through the citizens, through the community. And then we also share that early draft with the Transportation Cabinet District Office. The area development district offices, the planning agencies are the ones that help us with this planning. So on average, I'm going to say about a year and a half to develop a quality plan. And then that's just the first step. And then realistically, it takes probably another 3 to 5 years for implementation of some of the individual projects to start coming to fruition.
Thank you. So one of the things that you have mentioned is the need for community input. So what are some effective ways to gather that input, and how do we include populations that are most in need?
Well, we currently partner, like I said, with the AD offices, area development district offices. They have individuals that already work within each of the communities in their areas in transportation, in senior aging, housing, a little bit of everything in the communities. We also work closely with the mayor's office, city council staff, the county judges, to make sure that they know what we're doing, where we are looking at emphasis, because your mayors and your county judges are also members of the regional transportation planning committees. So we want everybody to know what we're doing. That's where the networking comes in. We share all of our information with the highway district office as well. So if they are doing a project on a certain road in that community, by us partnering with them and letting them know what the community wants, i.e. sidewalks or a bike path or a bike lane, at the earliest stages of planning with the highway district staff, they can include those elements into the highway district planning office. The money, the funding that's used for our transportation infrastructure is largely a tax base. So it's really the community's money being used to change that community's transportation infrastructure. So we try to integrate all of the already existing processes and integrate our planning activities for bike walk activity into the already existing infrastructure. It's been very challenging this past year with COVID, because in a lot of situations we normally would have multiple in-person community meetings at churches or activity centers or so on, for people to come out and look at maps and so on. So we've had to do a lot of things virtual. So I'm certainly used a lot of Zoom and GoToMeeting and Teams and so on. But we do have printed material that we also share at libraries, at churches. So really it's, we do as much as we can virtually. We send out, emails and notices as much as we can, but also word of mouth, good old fashioned, tell your neighbors, tell your friends. So we try to go through every resource we can to get the word out.
Thank you. We have a couple of questions about bikes specifically. The first is, someone said, you mentioned how expensive bikes can be. $1,100 was one example. Are there programs in Kentucky or elsewhere for people to have access to cheaper bikes that communities can add to their plans, maybe programs or grants or something that a community could incorporate to help more people get access?
Absolutely. And then my background is in the bicycle industry, so I'm kind of a nerd when it comes to bicycle data like that. There are quality bicycles, brand new, that you can get, for a couple $100. That's still a lot of money, but just on average, Americans, like their bicycles. So they've gotten, the prices of bicycles has gone up significantly in the last probably 5 years or so. Some communities like the city of Winchester, we worked with them years ago. They developed a bike walk master plan. They've started to implement some of the bike walk infrastructure in and around town. And they actually got a grant through the Paula Grant Foundation, administered by the Kentucky Bicycle and Bikeways Commission. They got a grant to develop a community bicycle resource. I think they purchased 20 different sizes bicycles. They have a program that is free for citizens. They go, there's a place downtown, it's much like a YMCA, it's like a fitness center. And there you get a card, much like a library card, and you can check out one of the bicycles for free. If there is a cost to it, I think it's maybe $5 a year. It's very, very low. So communities can develop a way to have community bikes. There are other communities that we've worked with that have integrated really, really low cost rental bikes into their downtown areas. Places like the Broke Spoke in Lexington, and I think there are other community bike shops in Louisville. We used to have one here in Frankfurt. So reach out to me and I'll send you information on how a community can develop a community bike shop or community bike share. And yes, we've done that several times.
Great, thank you so much. It's wonderful when we're able to make sure that all members of our community can access the same resources, which is what we're working on in the SPAN program. We have two questions that you've alluded to. They're similar, specifically about rural communities. So the first is, for bike walk master plans, are rural communities throughout Kentucky developing these as often as urban communities? And the next question is similar, which is just how much traction have you gotten in rural areas?
Most of the communities that our program is currently working with are rural. They're under 25,000 or less in population. Outside of your big metropolitan areas like Lexington, Louisville, Northern Kentucky, they certainly have a lot of population base, a lot of need, colleges. So it's easy to support their bike walk infrastructure because you see a lot of people using it. But honestly, in a small town like Moorhead, Kentucky, or Prestonsburg, or Calvert City, Kentucky, really, really small areas, one simple thing like adding a couple of bike lanes or quality sidewalks or a shared use path or reclaiming an old railroad bed and turning that into a rail trail system, if those are done correctly and put in the right place, those can transform a small community just by adding one simple facility. The traction part, your mayor, your county judge, your city staff, they have to think it's a good thing. They have to be involved. We've seen a direct correlation between communities that do all the planning work of what they want, where they want it, and a community that has a very supportive elected officials. That's like a combination that is a catalyst for even better and faster change. We have 490 communities in our city. We only have 60 communities that have a bike walk master plan. So yes, long way to go, but I see a lot of momentum moving in the right direction.
That's great, thank you. We're receiving some great comments in the chat box, in the question box, people sharing their experiences and their successes. Mount Washington says that they're in the early stages of a bike walk path. That's really exciting. So we're happy to hear that for you. We have 1 minute left, so I'll leave with maybe an easy question, which is someone has said, is there a bike association that people can participate in to have some group events to join to bike to work or school?
The fastest way to find out is to email me and I will connect you to local folks in your area.
Great, and Troy, your email is right there on the screen, troyhearn@ky.gov. I also just am putting it in the chat box as we speak so that anyone can email you with any remaining questions they have. We also love to hear the success stories that we're seeing entered in the question box as well. So feel free to email those to Troy or to the rest of our team at fitky@ky.gov. That's our 30 minutes. So thank you everyone so much for joining us today. We hope to see you next month. We're continuing this 30-minute mini webinar series on the third Tuesday of every month at 9:30. Thank you all. Stay warm.
Thank you, Ellen.